Great. Hi, everybody. Mary Jane Burke here, the Marin County Superintendent of Schools. Welcome. We're very happy to have you join us today to get an update from our public health partners, Dr. Willis and Dr. Santora. Just a reminder, this will be taped and will be shared within 24 hours. Will also be available in Spanish. Michelle, can you help us with the Spanish translation here?
Absolutely. Thank you so much. Hola y bienvenidos. Este webinar se transmite simultáneamente en español. Haga clic en el botón de interpretación del idioma que aparece en su pantalla si desea escuchar esto en español. Muchas gracias.
Great. Okay, so who's going to start? Dr. Willis.
I'll start.
I'll hand it to you.
Hi, everyone. Good afternoon. We'll provide an update on what we're seeing in terms of respiratory viruses. Then we'll talk a little bit about fentanyl and offer some recommendations for healthy December and into the coming year. Next slide, please. So we are seeing, and I'm going to cover each of these separately, increases in COVID-19, influenza, and respiratory syncytial virus. The so-called triple-demic is really not seeing, we're not seeing any signs of that abating yet here in Marin. This shows our COVID-19 numbers. We've seen almost a doubling in the number of cases in the past 3 weeks. We're at about 50 cases per day now in Marin, up from 25 in mid-November. And our percent positivity has increased to about 10%. So 1 in 10 people who are being tested for COVID now currently with PCR are infected. So those are both signs of increases in transmission. Our hospitals do remain stable with regards to COVID-19, although we are seeing now increased numbers of people being hospitalized for those other two, flu and RSV. Next slide, please.
Can I ask a question?
Yeah.
Can you go back to the previous slide? And what does it say? It says, so I get reinfection, that's the dark.
Yeah.
What's antigen detected only?
Yes. Yes. So this is a screenshot from our website. So
Okay.
anyone who's interested in looking at some of the more detailed information can look at our website. Antigen detected only is those are the rapid antigen tests that people generally do at home.
Okay.
And when we get the results of those, whether it's someone reporting on our website, directly self-report, or from schools or some of our facilities where we get the reports of the antigen tests, those are represented there. And the others are the PCR tests. And those are the tests that go to the laboratory. We have automatic reporting of those tests as well. And we decided to combine all those forms of positive results into a single view of our status.
And it's an underestimate because most people are not reporting when they do have a positive home antigen test, they're not reporting it into our systems.
That's right. Yeah, we recognize that over time, we are seeing a smaller and smaller fraction of the total number of cases, which is one of the reasons I'm referring to our wastewater also now more and more, which is that is a less biased view. And we are seeing increases in COVID-19 in our wastewater, about 35% increase in our amount of virus in wastewater over the past 3 weeks also. Next slide, please. Good question. Just to say, we had been talking about how the variants have really been contributing to our surges since the beginning of the pandemic. We had been kind of parked at BA.5 as the dominant variant for a long time, the past few months, really. What has happened has been what they're referring to as variant soup. So there's been a kind of an explosion of offspring, if you will, of BA.5, and this just summarizes that of the past 17 variants that have been sampled in Marin, there are 10 different distinct subvariants. So we're really seeing a wide dispersal of the different kind of variants. BQ seems to be emerging as the most common variant now. And fortunately, BQ does not seem to be any more severe than the previous variants and is behaving very much like BA.5. Next slide, please. But that's to say that we're still waiting to see what might emerge as the sort of the dominant new variant, and we're optimistic that it's not showing any signs of more virulence. These are the COVID-19 cases in schools. I just shared the population-wide, the community-based transmission rates. Now this is looking at schools, and not surprisingly, as we see transmission increase in the community as a whole, we see more cases in the schools. And this shows just over a 3-week period, cases in elementary schools, middle schools, and high schools have increased in all 3 of those over the past 3 weeks. Next slide, please. This importantly, if we're going to pick one thing that we can do, it's that bivalent booster coverage. This is the new and improved vaccine that came out in September. We want to be super clear that this is a new vaccine. It is different than the previous formulations, and it is better tailored to the currently circulating strains. And that's critical that everyone who can obtain the protection of that vaccine. When I look at these numbers, my eyes are drawn to the 65 plus and the 50-year-olds, the top ones there, because those are our residents that are most vulnerable to being hospitalized or passing if they're infected. 57% among 65-year-olds is not enough among those over age 65. When we look at our results, much higher risk of coming into the hospital and also higher risk of passing if you haven't been gotten that bivalent booster. And then there are in our younger age groups, 20% of our 5 to 11-year-olds and 24% of our 12 to 17-year-olds, low numbers, have obtained the protection of that new and improved booster. So as we see increased transmission, we really want to double down on the message that now is the time. If people have been waiting to get the protection of that bivalent booster, now is the time to do it, because just over the past couple of weeks, we've been seeing a lot more activity, both in the community and in our schools. Next slide, please. And there's our pediatric vaccine coverage, more specifically, and really seeing that not enough vaccine. 1 in 5 or 1 in 4 is simply not enough. Is there anything else that you thought was important about this?
Just that the other side that we often cite is just the differences among populations who receive the bivalent booster. So we see those who have not received the bivalent booster have 1.5 times greater risk of getting hospitalized. And still to date, we have not seen a death among someone who's received the bivalent booster. And that's one of the hard parts of our job, is looking at the death certificates and determining if it was a COVID death. And a few that I've looked at recently, they stayed up to date through their 4th dose, but did not get the bivalent booster. And so it could have been a preventable death. And I think of the school community, because I have grandparents as part of that. So seeing that this is another opportunity for families to talk to grandparents about getting the bivalent boosters to offer that level of protection, so we can gather during the holiday season.
That's right. That's right. Gather more with a better sense of security and comfort when we're together, that we're doing it safely. Next slide, please. Transitioning now to flu. This is emerging as really almost an equivalent threat for us as the health of our community now is influenza compared to COVID-19. We saw a 54-fold increase in the amount of virus in our wastewater since mid-December. We are seeing almost an equivalent number of people hospitalized for influenza as we are for COVID-19. In fact, across the state of California, as of yesterday, I think they actually surpassed that number. There's more people hospitalized for flu now than for COVID, which is really unfortunate, because we are seeing increases in hospitalization rates for both. Fortunately, RSV rates seem to be plateauing potentially at the state level. But again, this is really a very simple message, and that is to obtain the protection of the vaccine. Both flu and COVID-19 are vaccine preventable, and the flu vaccine is a good match for the currently circulating strain. And we still only in Marin have an estimated about 40 to 45% of those who are eligible to be vaccinated have received that vaccine. So good news is you can get both at the same time, the COVID-19 booster and the flu vaccine, and your medical provider or pharmacy will be eager to provide you the protection of both. Next slide, please. This is just another way of looking at our influenza surge, and shows that we're seeing a really dramatic increase in that green line is the percent positivity. That's 25% positivity. So that's 1 in 4 people who have influenza-like symptoms who are tested for flu actually are positive for flu. That's the highest we've ever seen, actually. And it both signifies high rates of transmission overall, which we know we're seeing, but also early. The other important feature about this year is that flu surge is happening really in late November and early December. Normally we have, this doesn't happen until later December into January, and is not as sharp as this. So we're seeing both a sharper and an earlier spike in flu than we've seen before.
And
Next.
the RSV is also sharper and earlier.
That's right, and RSV is also earlier. RSV was sort of started, and then we started seeing flu, and now we're seeing COVID come up. Next slide, please. Just in time for the holidays.
Right.
Here's RSV. This is our wastewater. You can see that sort of ever increasing sawtooth pattern of the amount of virus in our wastewater collection sites across the county. And talking to our pediatricians, they see the analogous flow of sick kids coming into clinics, or parents calling in with children who are having respiratory symptoms. When it comes to RSV, we are most concerned about our youngest kids, our babies, those who are smaller and don't have, their airways are smaller, they're more vulnerable to the respiratory distress that might come along with this respiratory infection. Different than COVID-19 and flu, RSV is primarily transmitted through contact. So if someone coughs or sneezes onto a surface, someone may touch that surface and then touch their face. The way common colds are often infected. This is the primary mode of transmission for RSV, which means that hand washing is probably the most important thing you can do to protect yourself against RSV. And importantly, especially if you have little ones at the house, babies at the house, frequent hand washing. If grandparents are visiting their grandkids, this is a good year to really make sure that hand washing is really well done, or as painful as it might be, foregoing passing the baby around at these holiday gatherings, because there's so much RSV out there. But frequent hand washing is a simple and very effective strategy for preventing RSV transmission. Anything else on RSV, Lisa? No. Surfaces, cleaning surfaces, wiping surfaces down. We're working with our child care providers or daycares to make sure that they're really on their A game with regards to those routine practices of cleaning all the surfaces and washing off the toys at the end of each day.
Just to reinforce that, doctor's notes is not required to return to school for RSV. That's something that we see a lot of parents seeking healthcare provider access just to get a note, especially during this time of year when they're very busy with really sick kids. There should not be a requirement for there to be a note to return to school after having a diagnosis of any disease. So we can just protect our pediatric providers from having unnecessary visits, so they really can focus on our sick kiddos. So that's one thing, and just something that we're aware of. There are still some childcare facilities that have stricter policies around RSV, and when the duration of time for isolation, that is their right to be more strict. The reason why we see more strictness, for example, they might require a 5-day period of isolation, is that they might be managing multiple cases of RSV that have required hospitalization, and they often have that younger age group that Dr. Willis was talking about, where they have more kids under the age of 2, and so the risk to that population is significantly greater. So they have a doctor's note in those cases will not allow you to enter. If it's the policy of a child care facility to have an extended isolation period, getting that doctor's note is not going to get your child back into the facility. We're in communication with all of our child care facilities. We understand the importance of getting kids back into that childcare environment as quickly as possible, but we also respect the autonomy of our childcare providers as well.
Great, thank you. Next slide, please. So here we go, higher and increasing RSV admissions. This is across Northern California. This is the data from the Kaiser Group, which covers the Bay Area and North. And those thinner lines are previous years from 2017 onward, and you can see that thicker blue line is this year, and you just see how unique this year is compared to previous years. And this is a very similar curve as what you would see for influenza as well, and explains why so many of us now in our own lives, our social circles are seeing people who are out with respiratory illness and not testing positive for COVID because again, there's a lot of other respiratory viruses. This is very likely due to a combination of factors. One is that we have what's called immunologic debt, where after a couple of years of doing really good work together to prevent viruses from being transmitted between us with our COVID precautions, we now our immune systems are a little more naive. So these viruses are sort of catching up, making up for lost time and affecting our immune systems. Also, at the same time, they're inherently seasonal. Both RSV and influenza are seasonal viruses. We would expect to see surges every year, as you see in this graph here. And then finally, all that's coinciding with more indoor, especially in Northern California, as the weather gets colder. We're coming inside in new ways, and we're gathering together in new ways. We're seeing the predictable surge post-Thanksgiving. And these all combine, I think, for us to just be really clear in our messaging that as we gather together now and through the rest of the holidays, to take every precaution we can among those things we have control over. The most important, again, being vaccine for flu and the bivalent booster and face covering. Good thing about face covering is that it covers for all three, RSV, flu, and COVID-19. You can prevent getting infected with those with a good quality face covering if you're in an indoor public setting. And Dr. Santoro will go over even more of the precautions we can all take in the recommendations shortly. Next slide, please.
Can I ask a question?
Yeah.
So I know how COVID is identified. How do you identify or diagnose RSV or the flu?
So RSV, so COVID-19, home antigen test, easy, and then PCR. With influenza, it tends to be a clinical, you might get your clinician if you're having symptoms and you visit a clinician, they'll do a flu test at the clinic.
There's actually a test.
There's a test for influenza. Usually it's done in an emergency department or in a medical facility. And then for RSV, this data is actually the percent of children who are admitted to the hospital who have RSV, who are confirmed to be infected with respiratory syncytial virus. So that, unfortunately, we don't have, maybe next year or the year after, they're working really hard to develop convenient, rapid tests for home testing where, you and I could, if we're having respiratory symptoms, do that like a COVID test and get results, both RSV, flu, or even other respiratory viruses, but we're not quite there yet. Next slide, please. So here we go.
All right, so we have lots of layers of protection. We've shown our Swiss cheese, and it takes all of the above to decrease our risk as much as possible. At a minimum, and we can't say enough, now is the time to get your COVID-19 booster and flu shot. We have a triple-demic, so we're going to double down on vaccinations. To do more, it is lots of protective behaviors that we used in the past. It's wearing the mask, as Dr. Willis said. Testing, this is such an important, affordable tool. Before you're going to gather during the holidays, test yourself. We see most people aren't testing, even if they're not feeling sick, because they don't want to know the results. That's not a good reason, especially if you're going to be spending time with individuals who have not received the bivalent booster and are more vulnerable for having illness or poor outcomes from a COVID-19 infection. Get the airflow moving. We've seen this since the beginning. COVID hates the air and the outdoors. So if you can go outside for your gatherings, go outside. If you can't go outside, open those windows, open those doors. The ventilation is one of the greatest tools and most affordable tools that we have against any respiratory infection. Again, if you have that itch in your throat, if you're starting not to feel good, we know it's time that you want to gather, but stay home when you're sick. Test yourself. And last but not least, these last two work all the time. We're just really bad at, especially the second to last bullet about washing our hands. It's such an important tool. Make sure you ante up and get some of those hand gels if you haven't restocked, and covering your cough. That is if you're not wearing a mask, make sure you're covering your cough. And that is another way where you, again, protect the movement of air droplets that might be affected into our shared space or shared air. Jump to the next slide. And our other role in public health is really protecting our healthcare system. what we've described is the conditions that have our family doctors and pediatricians very, very busy with email and telehealth visits and in-person visits. So there is stress to our healthcare system. They're working hard trying, they don't have the same resources to send kids to hospitals for intensive care. So they're providing more care in our local hospitals. So there's a lot we can do for self-care if you do have an upper respiratory infection. Of course, you want to seek care. If anytime a parent is scared or concerned, that's absolutely the time to go and ask your doctor for guidance. But there's a lot we can do with just congestion relief at home. Using a humidifier or using a neti pot or some of those saline sprays are really effective about clearing those passages. Staying hydrated, one of the biggest risks, especially for that under two-year-old population, is not the virus itself or the respiratory symptoms, it's getting dehydrated. So using Pedialyte and water, just keeping your children hydrated. You can manage fevers at home. So if you have a fever up to 101, just purchase some over the counter ibuprofen or acetaminophen and read the instructions and dose your children to their weight. If the fever is prolonged or goes over that 101, again, if anytime mom or dad is concerned or grandma and grandpa are concerned, that's the time to call the doctor, but you still can do a lot at home. And again, staying at home, don't shorten the time that you're isolating, stay at home for at least 24 hours and make sure you don't have fever make sure you don't have a fever and you're not masking the fever by using those fever reducing medicines before you go back into socializing. And again, remember with the COVID-19, after you've been sick, it's recommended that you wear the mask for up to 10 days after you've been diagnosed with COVID-19. So again, just further reducing the risk of transmitting it to someone else once you're feeling better. So I think that's... Oh, so we mentioned this was just out of order. This is just a reiteration of that effectiveness of the boosters. We look at local data always, and we've seen that those who have received the bivalent booster are protected. We're going to be getting updated data for the 50 plus population. And as we said before, that there were 0 deaths among those who are 65 who had received the bivalent booster. So it really is a vaccine preventable hospitalizations and more importantly, deaths. Jump ahead. There we go, back to you, OD-free Marin.
Great, yeah, so as we're all aware, there's been another emerging crisis around of public health, and that has been the fentanyl crisis. In fact, in 2021, for anyone under age 60 in Marin County, the risk of dying from a fentanyl or dying from a drug overdose was 10 times higher than the risk of dying from COVID-19. So as much attention as we've paid to the pandemic, it's important to recognize that this is also something that we need to focus our attention on as a community. And in that spirit, we launched on November 15th, a coalition, a countywide coalition called OD-free Marin to combat the problem of preventable overdoses. It is a restructuring of what had been called RX Safe Marin. The reason we changed that coalition title and strategies is because the problem of prescription drugs, which launched our RX Safe Marin in 2014, has really changed to a problem of overdoses from non-prescription drugs. So as the problem itself has changed, so must the strategies, the partnerships, and the name. So OD-free Marin is now our community-wide coalition to reverse the problem of overdoses. We have 5 different action teams. It is open to community members and others across multiple sectors to engage. We had sold out on the 15th, lots of interest in this issue, and we've got now the action teams are off and running. This is one of the most important collaborations with our school community. Marin County Office of Education, Mary Jane Burke and the team have been close partners with RX Safe Marin for years and will remain close to us as OD-free Marin. And we're inviting anyone who may be on this call or who are interested in joining this effort to please join one of the action teams represented here, one focused on youth, another on equity, one on intervention, treatment, and recovery, education and outreach, and then justice system involvement. And you can learn more about that at the website that was just put in the chat. With the schools, we're working on expanded curriculum for middle and high school. One of the most important elements for us is just simply awareness, so that our young people recognize that when may have been normal, if you will, experimentation in the past is now potentially lethal because the drug supply has been poisoned with fentanyl. We're seeing, unfortunately, an increasing number of our young people who may have purchased what they thought were prescription or counterfeit prescription medications on the web, Xanax, Percocet, or other elements, even with one pill, actually having a fatal overdose event because of the opioid fentanyl. We're also working with parents and families in the Let's Talk. Let's Talk is both a booklet and a series of messaging suggestions for parents, and also a series of talks and community convenings over the course of the year with webinars. We're also working with the Marin Schools Wellness Collaborative. So the wellness clinics across schools are coming together on a regular basis to discuss how they can best collaborate. And RxSafe or OD Free Marin is contributing to that as well. And then Narcan, finally, reversing an overdose that may be occurring from an opioid with Narcan. Narcan is almost a miraculous, to me, medication that can, with the nasal spray, immediately reduce and reverse the effect of an overdose. And we now have Narcan available in 95% of our public schools on campus. And we are working to train school staff and others with the Marin Medical Reserve Corps to make sure that Narcan is just, close at hand if there is ever an overdose that would occur on campus as part of a larger initiative to get Narcan out more widely across the community.
How much time would you have between observing someone who might have had an overdose and actually issuing the Narcan?
Well, it depends on whether they're breathing. So, one of the problems with an opioid overdose like fentanyl is that it both suppresses consciousness and breathing. So if someone has a very serious overdose, the reason people pass is that they'll simply stop breathing. They'll fall asleep, essentially, become unconscious, and then stop breathing. And, at that point, 5 minutes, it's all, you'll probably be dead within 5 minutes if you stop breathing. Fortunately, when people are experiencing overdoses, it tends to be sort of a continuum where they're losing consciousness, their breathing slows down. And in there you have, you would have up to 5 minutes to find that Narcan and give that. But within honestly, within a few seconds after administering Narcan, breathing is restored. So it's one of the most vivid experiences for me in my emergency medicine rotations was reviving people who come in nearly, totally unconscious and barely breathing, and using Narcan immediately rousing. Sometimes not happy, but alive.
Yeah. If it's not an overdose, could you hurt someone with
Narcan is completely harmless. It's only really that has any effect if someone is having an overdose. And it's like Afrin, it's like a nasal spray, very easy to use. And that's part of our messaging. It's for people to recognize that it's available for anyone and should be at hand if you have any concerns about anyone in your household or anyone at the school level.
Yeah. So I think the important part for our schools is knowing where the Narcan is.
That's
right. So it's one thing to have it at the campus, but everybody needs to know where exactly is it on the campus, because there's not going to be much time.
That's right. It's like an EpiPen.
Yeah,
you want to think about it.
exactly.
Keep it near where that EpiPen is.
Right.
And recognizing the signs. Thank you.
Yeah.
Next slide, please. And then join us at our 2023 public health update. So we decided that we would do another convening on just after everyone comes back from the winter break. Just, we don't know what the next few weeks are going to bring.
Last time they brought Omicron.
Yeah, right.
Right. Oh, I didn't know. Oh, yes.
Well, so we hope that it will be a brief and reassuring conversation on the 12th, but we thought it would be important to at least have a placeholder for a community-wide convening. So please join us at our next one, and that will be with John Carroll.
Yes, our new county superintendent will be taking this seat, John Carroll, and he's very excited to be joining this team that you're seeing here. So I have a question. What's your recommendation for testing or as we come back in? I just had that question. I was meeting with some of my colleagues. So most of the people in our schools will have had a couple of weeks off, and they'll be coming back on January 3rd, I think. Do you recommend that they, assuming we have plenty of tests, we've just received a new supply, do we want them to test before they return? Or should they use the judgment we've been using depending on if they've been involved in at-risk behaviors?
The judgment we've been using has been working to date. We know that there is some communities and school communities that opt to have a test requirement to return to school. That is absolutely, acceptable and encouraged by the state. Honestly, it really depends on when you've had those gatherings and when you've traveled. So usually it's in the 3 to 5 day range after travel or gatherings where administering a test would probably be most optimal of identifying, especially if you're having asymptomatic COVID-19. But if you've been not engaging in travel or gatherings in the week prior to school, you're not at high risk. So it really depends on the timing of your travel and your gatherings and when you should test. And anytime you have that itchy throat or any symptom and test. And then often what we still see is many people have to test again because we have immunity, we have been vaccinated. Sometimes your first symptoms, you'll have a low viral load and it might take a day or two for you to actually test positive. So don't hesitate to repeat testing if you test negative.
Yeah, I agree. I think we would have sort of the highest yield from our testing as a tool if every time someone had symptoms, if they tested appropriately. That's better than having just, I think, a universal testing no matter what kind of policy. Really just doubling down on that expectation that if you have viral respiratory symptoms, we know that's going to be happening a lot because we're seeing flu, we're seeing RSV. And then, behind that should go without saying, but we'll be clear that you should not be coming to school.
Right.
If you're having fever and a cough and feel poorly, even if you're testing negative for COVID, it's something else that is infectious to your classmates and to your teachers, and don't come to school. And we want to make sure that our schools are sort of recognizing that they have to support kids who aren't able to come into school. We'd rather err on the side of, having those kids, especially if they're actively infectious and ill, really take the time they need to stay home.
Do we have any other questions, Michelle or Mike?
There are no questions in the Q&A. You guys have been very thorough, I think.
Okay, thanks.
I gotta,
Yeah. What?
this is your last.
I know, this is it, right?
This is it.
Except it's not, I'll still be around, you'll have more people on these calls, and I'm sure you both will agree that perhaps these last 3 years have been like, how lucky have we been to lead, not just in Marin County, but across the state and the nation, to have had the partnerships we had prior. And so just to everybody, reminder, relationships matter. You never want to find yourself going into a pandemic and not yet knowing who the public health team is, right? But it's been like, in my career, of perhaps the most meaningful, important time that I've had. So I'm so honored to have done it with all of you and my Rethinking Schools team and all of my district partners. So thank you.
I think of one thing when just of you and what you've taught me, it's really just focusing on the kids and having that laser focus. And as we move into recovery, we need to maintain that same focus. So it's not going to be COVID-19 as our next threat. We have maybe some more complex and challenging threats with behavioral health issues and social connectedness and fentanyl. And as a community, we just need to focus on our kids and think about what's best for our kids. So you've taught me that lesson, and I will carry that forward.
No, that's great.
Thank you, Mary
That's
Jane.
great. You're welcome.
Yeah.
Say bye, everybody.